I'm Dr. I.P.S. Kochar, pediatric and adolescent endocrinologist and diabetologist. Today I will be talking a little about diabetes in children. Diabetes in children is becoming a big problem now these days. More and more patients are coming up with diabetes, type 1 diabetes and type 2 diabetes. Now, the issue is that the parents are not ready to accept this problem. How can my child have diabetes? No, it's increasing the lifestyle and so many other factors. Obesity is one of the factors that you start getting type 2 diabetes in children. Now, very important to remember is in type 1 diabetes, if the child is losing weight, if the child is passing excessive urination, if the child is bedwetting, certainly he was okay before, now he starts wetting a bed. So if the child is having excessive thirst, and or if the child is getting, an infection in the body, and especially in girls, if they get vaginal infection, once you start thinking of that the child may be having diabetes. Very important thing to remember, type 1 diabetes, the treatment is insulin and only insulin. Insulin has to be given, so there is no need to go and do doctors, meet many doctors, because once you start on insulin, the child will definitely become better. Second thing is that, this in cases of type 1 diabetes, they have to take insulin for almost a lifelong. Third thing is that, these symptoms start becoming better. Once the child is put on insulin, they start becoming better, the weight starts becoming better. The urination, the excessive thirst, this all disappears. That is an important thing to remember. And the fourth thing is it is not a family. It does not mean that, if the father or mother does not have diabetes, then why the child got diabetes? No. Type 1 diabetes it's not like familiar or not like, genetic or this thing that it is because the father and mother. That's type 2 diabetes. So that is very important to understand. The treatment is insulin. There are a lot of new devices which have come up, new insulins have come up. New insulin pump is available now for children with diabetes in order to help them control sugar and have a better lifestyle and better flexibility. Diet is another important thing which there's a lot of myth. Actually, children with diabetes have a normal diet, so they can have sugar things, they can have sweets also, but within limits, and that also when they're taking insulin. So that is very important to understand that making a good diet, balanced diet is equally important in children because they are growing, they are having they have a growing pattern, they have puberty, they are more prone to have hypoglycemia, they are more prone to get, ketoacidosis. So that is why one has to be a little more careful in diabetes. Second thing is type 2 diabetes. Now the incidence of obesity is becoming more. Both lot of children, both बच्चों का मोटापा हो जा रहा है आजकल. उसकी वजह से क्या है that many of the kids are going into early diabetes, pre-diabetes. So their weight is becoming more, and because the weight increase, their insulin levels start rising, and then when insulin levels starting, that is the earliest sign that this child may get into diabetes in the future. So the sugars start rising. So that is why, because of this obesity epidemic, the type 2 diabetes also has increased a lot in the adolescent and the children population now. So one has to keep this in mind. Then there is, the important thing is, so therefore controlling of the diet is very important, this type of diabetes. They have to take intake of food should be decreased. They should be more careful about the lifestyle, regular physical exercise, regular diet control, fixing of the amount of calories we take, less sweetened fruits, less sweetened beverages, less sweet fruits. Not only there's a normal that all fruits no problem, but no. If you have very sweet fruits, you will also get problem with this. So therefore, avoiding all drinks and juices, that should need to be a point. And especially the intake of milk products should also be decreased. So in the type 2 diabetes, it's a lot of good physical exercise, good diet control, and then maybe in some children they are using some tablet called as metformin in those some children, and it helps in the control. Whereas in type 1 diabetes, insulin is required and insulin is must. So therefore, if you are finding that when a child passes urine, there is collection of ants, so they just keep in type 1 diabetes. If the child is losing weight in spite of eating, then there is a chance of being a type 1 diabetes. If the child is feeling tired and lethargic very quickly, he says, we used to play well before, now he plays and he gets tired very fast, so there is a chance of type 1 diabetes. If the child is passing excessive urination, there is a chance of diabetes. If the child was not wetting his bed and started wetting the bed, now suddenly there is a chance of type 1 diabetes. If the child is eating food but still losing lot of weight, there is a chance of type 1 diabetes. So all these symptoms one must keep in mind and always be careful, if you find. So it is not that if the family does not have the child, so any child can have type 1 diabetes because it's normally is an autoimmune process. So therefore, keeping all this in mind, one should always remember type 1 diabetes is there. And I would like just to tell that if your child has these symptoms, please do see a pediatric endocrinologist. And I am available, and you can contact me through lybrate.com, or you can meet me at my clinic. Thank you.